Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today, we're going to continue on the journey of dysglycemia or dysregulation of blood sugar. Today's focus is going to be on hypoglycemia or low blood sugar. Oftentimes, hypoglycemia is neglected within the medical community. They're usually focused on diabetes, insulin resistance, insulin-dependent diabetes, and so forth. But hypoglycemia can be just as bad or detrimental for that patient as diabetes. So it's a very important topic today about low blood sugar. We're going to go over 3 different patterns of hypoglycemia or low blood sugar, okay? So defining it, hypoglycemia, when due to a pathological process, fasting blood sugar, right, first morning sugar with fasting between 10 and 12 hours, the first morning sugar will be below 65, okay? The pattern is caused by either a disease or exogenous insulin or medication. So sometimes a diabetic who takes too much medication will go into hypoglycemia or low blood sugar state, okay? So a pathological process. The other one is called functional hypoglycemia. So the first fasting morning glucose is below 85. Another thing that you'll see with that is something called LDH below 140. LDH stands for lactate dehydrogenase. And when this marker in the blood work is below 140, then it can indicate that you have a functional hypoglycemia, along with the fasting blood sugar below 85, okay? Another one is called reactive hypoglycemia. Reactive hypoglycemia, some of these markers may look normal. However, the symptoms of low blood sugar, which we'll go over in the next video, the symptoms of low blood sugar occurs within 4 hours after eating. So you eat and you have a rapid decline in blood sugar, and you start to experience signs and symptoms of low blood sugar. So when we define this and we go over symptomatology in our next video, you'll start to understand what is going on with patients. So it's important to define what it is. Why are you having low blood sugar? Let's say hypoglycemia can occur due to a pathological process like POTS, or postural orthostatic tachycardic syndrome, which is an autonomic issue, maybe related to a concussion, right? So if you have a concussive process, and you'll start to develop hypoglycemic symptoms. The functional hypoglycemic are the people who will get up in the middle of the night, maybe 1 or 2 in the morning because of a low drop in blood sugar, and it creates increase in cortisol. So we're going to define all the signs and symptoms and patterns in our next video, okay? So it's very important. This is a very important topic for a lot of people because they have all these symptoms, but there is no clinical management of these patients, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you in the next video going over all the symptoms of hypoglycemia. Have an awesome day.